Hi, everybody. Welcome to another edition of our live virtual coffee hours. I'm State Senator Mallory McMorrow, and we are live streaming this across Facebook, YouTube, Twitter, and LinkedIn. So for a reminder for those of you who have been here before, or if you're new, the way this works is I provide an update on what's happening in the legislature. This week, we are doing a unique focus specifically around COVID-19. So we're going to be talking about the current state of the virus here in Michigan and what this means as we move forward into holidays and what this means in the legislature moving forward. But if you have any questions or comments, feel free to go ahead and type them into the comments section, and we will try to get through as many of those as we can. So again, welcome. I'm State Senator Mallory McMorrow. Glad to have everybody joining us. And, I wish it was under better circumstances. I think that as we look back through history, I remember when this pandemic started and we did a live event where I reviewed a number of the reopening plans from Harvard, from AEI, from a bunch of different institutions, from the CDC. And a lot of it talked about history. And we know that during the 1918 flu pandemic, it wasn't the first wave of the virus that was the deadliest. It was the second wave. It was the fall and the winter where things got really, really bad. And we're seeing that play out again. So, first of all, I just want to reiterate, I understand that this is hard. It's hard for everybody. I am almost 7 months pregnant right now. And looking forward to virtual baby showers, not seeing my family for Thanksgiving or Christmas or New Year's, and hopefully delivering our first, a daughter, safely in January. But I myself am, because I am pregnant and there's limited research on COVID and pregnancy, I'm somebody who, based on what we know, is at heightened risk for severe illness or pregnancy complications should I contract this virus. So I have been very, very careful since March. I have gone to a restaurant exactly twice in the summer and sat outside both times. Otherwise, it's been ordering in and staying at home. And really my only time out in public is going to Lansing and back to the Capitol to work, wearing a mask the entire time. So, I think we have to acknowledge that everybody's tired of this. We're all tired of this. We don't want to shut down. We want to go back to normal. We want to see our friends and family and have that sense of normalcy, and it wears on us, especially as we look forward to the holidays. But the virus isn't done with us yet. So we had some news this week from the legislature that multiple colleagues have tested positive for the virus. The House actually canceled their session this week. And it was revealed that a number of legislators tested positive, and from my understanding, a few are at home and very sick with this virus. So I want to make sure that I wish everybody a speedy recovery. And then just today, this afternoon, we got news that 2 additional people in the Senate, including at least one lawmaker, have tested positive as well. And this is somebody who I was in committees with yesterday. So we're seeing it everywhere. And I'm hearing from a lot of people who are now seeing members of their family or friends test positive. We had a contractor who was supposed to come to do some work on our house who delayed because he tested positive for COVID-19. So this feels very, very different than what we saw in the spring because it's not concentrated in one area. It is spread throughout our entire state, and it's spread throughout the entire country. So earlier this week, all of the leaders of hospitals from around the entire state of Michigan got together for a press phone call to really warn about where we are right now, which is that our hospital systems across the state are nearing or at capacity at the moment. They are seeing a rampant uptick in hospitalizations, some very severe. And the difference between now and when we saw this back in March and April, Metro Detroit was hit really, really hard. And we had people coming in from all around the country to help us in Michigan. We were one of the first hotspots in the country. Much of the rest of the country and much of the rest of the state, frankly, wasn't dealing with this virus yet. So there was a call that was put out for medical workers, for nurses and doctors to come to Michigan to help. And they did. People came from all around the country to help us when we were at our very worst. And we saw, those horrific photos of body bags lining up in closets and extra rooms at hospitals in Detroit. I know Beaumont was working exceptionally hard and had taken over every wing of the hospital with COVID patients. And we had, local groups bringing food to the hospital every night. And that was the very worst. But right now, one of the problems is when you look around the country, the entire country is a hotspot. So there was some talk over the past week about potentially reopening the field hospitals that we had set up at TCF and the Novi Showplace in case our hospital systems do get overwhelmed. But the problem now is not the space, it's staffing, because we're not going to be able to have medical workers from all around the country come to help us in Michigan because they need to stay in their own states. We are seeing Wisconsin, one of our next door neighbors, show staggering numbers and cases, and they have already opened field hospitals there in Wisconsin. We are seeing schools close already, restaurants close, and I just want to highlight a few of the things that are happening around us. In Ohio, Governor DeWine is closing restaurants and bars again and has instituted a mask mandate there statewide. Wisconsin has instituted a stay-at-home advisory. Wisconsin is in a similar place to Michigan, where the governor no longer has the authority to act via executive order due to some lawsuits, but there is a very, very strong stay-at-home advisory. And Chicago instituted a 30-day stay-home advisory, only allowing for essential travel, going to the grocery store, going to work, but prohibiting indoor gatherings, prohibiting having in-home contractors, whether it's a house cleaner or a medical worker, come into your home, or a tutor. And it's a really, really bad situation that we're in right now. So as we look forward to Thanksgiving and the holidays, I just want everybody to know kind of where we are and to be careful. I will be the first to say we're not going to be doing any holidays with anybody outside of my household this year. So I live with my husband, and we've made the very difficult decision to see each other virtually, say hello on Zoom. But it's just too great of a risk right now, with as much as we are seeing this virus spread and wanting to control where we are right now. So I've got some information in front of me. I was trying to see if we could do some screen sharing, but I couldn't get that to work. So I'm going to test that out for next time. But again, this is a relatively new system. But the CDC put out some guidelines this past week, specifically around holiday gatherings. And their number one recommendation is don't do it this year. Do not get together with people outside your household. And there were some really heartbreaking stories that I heard listening to the Start Here podcast a couple of days ago from some doctors who are on the front lines, who are saying they are seeing, a husband come in and be on a ventilator and probably not make it, and seeing his wife as well. And most of the worst spread right now is among family gatherings. Ohio's Mike DeWine shared that they are seeing a rampant increase of cases that are spreading from post-funeral gatherings. So not the ceremony of funerals themselves, but getting together afterwards to eat and drink and take off your masks and talk to each other, and just the weight of that, that we're going to, number one, you're gathering already to mourn the loss of a loved one, and that gathering itself might lead to even greater loss. So I think it's really easy to get comfortable around our friends or family, especially if we think that they've been safe and they've been practicing, social distancing and wearing a mask. But that is where a lot of the spread is coming from, is dinner parties, graduation parties. Many of the superintendents in our districts shared frustration that there are parents who are hosting homecoming parties for kids in their basements this year. And acknowledging, the kids have had a really, really hard year. We all have. But every time there's an exception like this, the virus continues to spread. And yes, we know that for younger people, there is a much greater chance of recovery. But there is, stories of younger, healthy people who, yes, they have recovered technically, but that they've contracted this virus and many, many months later are still having complications, still having difficulty breathing. There were some reports that a significant proportion of younger people who tested positive and recovered are now dealing with anxiety, depression, onset mental health challenges as well. So we're still learning about this virus. It's still very, very dangerous. But number one, I just want to stress, we are not doing holidays together as a family outside of my household. And I know that's really hard, but we know that on the good news front, we saw the news that Pfizer, their vaccine is proven so far in early testing to be more than 90% effective. So there is light at the end of this tunnel, but we have to get to that light first. And that's going to mean that we've got to make some tough decisions this year around how we behave and how we decide to do holidays. And if you have the ability to work from home, or you're an employer that has the ability to allow your employees to work from home, please do that. My office has operated fully remote since March. And yes, we have to figure out new ways to do things, but especially with the news this week of the number of representatives, senators, and Capitol staff who have tested positive, I can't in good conscience bring my staff back to work in that office knowing that there's a heightened risk there. So some additional guidance from the CDC. If you are considering a family gathering, number one, I want to stress again, the safest thing you can possibly do is not gather with anybody from outside of your home. But they're advising that if you are considering an in-person gathering, that consider the number of households. So right now in Michigan, gatherings of 10 or less are allowed at home, but there's a great difference between 2 households of 5 people getting together and 5 households of 2 people getting together. So each additional household is potential for exposure, because you have to think of how many other people have those people been exposed to, and they're all coming together in your home, and if they've been tested. So that's one thing to think about is think about not necessarily the number of people, but how many additional exposures you are creating for yourselves. Also considering community levels of COVID-19. There's a great interactive map from the University of Georgia that they developed where you can actually go in on a county by county basis across the entire country and assess and get a rating of how risky an event is based on community spread in that county, current hospitalization and fatality rates, and the size of a gathering that you're looking to hold and whether it's inside or outside. So we'll be happy to share that tool with people who are interested in, and some of the additional behaviors during the gathering. If you are going to get together, continue to wear a mask. I know that it feels impersonal, especially around family and friends, to wear a mask, but that is the guidance officially from the CDC. They've also advised to bring your own food. We have a lot of people at holidays who gather around the kitchen or gather around the plate and are getting close to each other in those close contact situations. So they're advising bringing your own food, staying a significant distance apart from each other. If you can have a holiday event outside, that is significantly safer than an event indoors where the air is not as circulated as well, especially with the heat on and our windows closed. It's just a real opportunity for spread. So if that sounds like a really impersonal event, and it is, this might just not be the year. This might be the year that we put it off and we tamp down and stay at home separate from each other and plan to come together next year when it's safe and can do so safely. So in Michigan, just so you know, again, the hospital systems are near capacity at this point. Our 7-day positive test average is currently 12.19%. And many of the plans for closures, for restrictions, even from my GOP colleagues who had put out plans and from kind of every national organization, says that really any positive case rate under 5% is cause for alarm and cause for mitigation actions to be taken. And some experts say a positive test rate under 2% is where you really should be, and that you shouldn't really be out and about anything above that. So that's really, really high. And again, that's a percentage. So it's not about the amount of testing we're doing. Even if we do more testing, it's 12.19% of the total number of tests that we're doing. And we are right there right now. There are currently 236,225 total cases in the state of Michigan, and our 7-day death average is 45. So it's really, really high. And there are people who are losing their lives, really unnecessarily. There's a lot of simple action we can take. So now I want to address what we can do about it. So as many of you know, here in the state of Michigan, the Supreme Court ruled that the governor no longer has emergency authority under the 1945 Emergency Powers Act law to enact actions via executive order, which means that it is now the responsibility of the legislature to take action. And however you feel about that ruling, whether it was the right thing to do, my biggest frustration is that has now been our responsibility as the legislature, and many of my colleagues are refusing to act. I know the House was canceled because largely of the COVID cases, but the statement from the House on why their session was canceled was that there wasn't anything urgent to take up in the legislature. And I think this is the most urgent thing we have to address right now. We've had some emails come in this week from people asking what I plan to do about it. And it's a great question. And I wish that I could do more. The legislative majority is currently the Republican Party. So Lee Chatfield and Mike Shirkey put out a rule for us. We were no longer allowed to submit any new bill requests as of October 31st. So I would be the first, I will tell you this right now, to be passing a mask requirement or introducing a mask requirement for us to vote on. I can't introduce a new bill. The only new bill exceptions are anything that is allowed and granted an exemption by the majority leader, Mike Shirkey, or the Speaker of the House, Lee Chatfield. So our hands are tied on what we are allowed to introduce, which puts us in a real bind because there are real actions that need to be taken that we can't take up unless the legislative majority chooses to act. So a lot of this is directly in their court right now. I have been very, very vocal about what needs to happen. I will be happily in my car in a second going back to Lansing to work on these things to address COVID-19 and put protection measures in place. But we are tied. And unless they decide to change the rules, that's where we are right now. So that's a lot of me kind of talking. Obviously, you understand where I am on this. This is something we have to take seriously. I don't want us to go into the holidays and into the new year, especially with such promising news with a vaccine on a horizon that needs to continue being tested, needs to go through the FDA certification process, and then likely won't be widely distributed to most people until well into 2021. But there is an end. And I think one of the things that I heard yesterday in the governor's press conference that is true is just because we are allowed to do something doesn't make it safe. So I'm doing everything I can to exercise caution to protect myself and those around me. I would encourage all of us to do the same. This is not a political issue. This is a really, really devastating virus that is getting a lot of people sick with long-term consequences that we don't totally understand, and killing a lot of Michiganders, our friends and neighbors and family members. So I apologize for how somber this update is, especially on a Friday. I usually like to try to keep these pretty light. But with that, I will kick it over. If you have any questions or comments, feel free to respond on whatever platform you're on. It feeds all of the questions into me. And just so you know, because we do have people responding on multiple platforms and seeing these videos potentially after the fact, the way that I do this is I read your name out loud, I read your question out loud, and then I will answer it just to make sure that everybody knows the context and we know where the questions are coming from. Okay. Tad Blankenberg says, I have seen the public service ads regarding masks, and that is a good idea, in my opinion, rather than a mandate. The best way to fight any disease is with a healthy body, and I would like to see that as more of the public discussion. For my limited understanding, obesity, high blood pressure, and diabetes put a person at much higher risk for a bad experience with this virus. Tad, I think that you are partially right. There are certainly limits to what we are able to accomplish via legislation. When this started and we were in the worst of this pandemic months ago, and there were fights and people actually getting killed in confrontations about mask wearing, there has to be that balance. There is the balance of what we pass into law or what is done via mandate. And then we also have to have a cultural acceptance and understanding that we are all on the same team. We're all in this together. And I think that comes from both sides. So, a lot of people then ask me, what should I do if I walk into a store and the store owner isn't wearing a mask? My advice then was not to get into a confrontation, but to walk out. And what has been frustrating is the fact that wearing a mask has become such a politically divisive issue. And my hope is that we can all come together. This is a very, very, very simple thing. Granted, it's not the only solution. Just wearing a mask isn't going to make this virus go away, but it does dramatically cut down on exposure and spread of the virus. And we've even seen, from financial reports that widespread mask wearing in the United States could save our economy $1 trillion. Just think about how much the first CARES Act funding package was, which is, around $2 trillion. $1 trillion we could save economically if a majority of people wore masks a majority of time that they were in public. So I think it has to be a combination of the two things. I think that there is legislation that we do need to pass to require certain things in the same way that we require seatbelts. We determined as a country that the safety benefits of requiring manufacturers to put seatbelts in cars far outweighed the risks of doing nothing. And I think that is part of it, but there's also the piece of it that is advertising, that's public campaigns, but also all those of us who are in elected officials rallying together and not taking these things up as divisive issues. So I was very encouraged by my colleagues on both sides of the aisle yesterday in Lansing. It was the first day since March where everybody that I served with was wearing a mask. And I would love if we did not have to require or pass these things into law, if everybody did their part and stepped up and did that. And I think that's a part of it. And then in regards to the second point of your question, of course, as with any virus, your heightened comorbidities puts you more at risk. But that doesn't mean that we accept the fact that this virus is killing a lot of people. And again, it is causing months, if not a lifetime worth of damage, even to people who are healthy. This is a virus that we do not fully understand. And yes, we do need to have a larger conversation about how people take better care of themselves, how we make that more accessible to people, how we make sure there are not food deserts in our communities, that we have a healthcare system that promotes preventative care. I mean, these are all very, very big issues. But just like anything, when you get cancer, your comorbidity, if you are obese going into having cancer, that's going to be much harder for you to fight that off. But what I don't want to have happen is that we deflect on wanting to fight this virus by saying, you know what, the only people who are dying are the ones who have comorbidities, because that is, number one, heartless, and number two, not entirely true. We should be doing everything we can to save our seniors, to save those who have a comorbidity, and to not accept that there's another thing that we can prevent, that is preventable, from making our friends and our neighbors and our family members very, very sick. So that was a long answer, but I appreciate the thought. Lisa Efros asks, what about some uniformity on the state level regarding school closing? Lisa, this has been a contentious issue from the beginning. As we saw back in March, apologies for 1 second. back in March and April, this was a new virus, and it was a new virus for the entire country to grapple with. And what we saw then was states across the country introducing statewide either shutdowns or closures or mandates as kind of a blanket solution. And there was a lot of pushback from people who wanted more localized control, who wanted it to be more based on what's happening in your community than necessarily a statewide experience. If you live in a more rural area where you don't have, the density of population that we have here in Metro Detroit, in the suburbs, and I think there was some validity to that argument and frustration. But at the time, we didn't know enough about this to be able to respond in that kind of surgical way. So the hospitals, all of the leadership who held a press conference earlier this week, advised against a statewide shutdown. And I will be the first to say, I think that's right. I don't think anybody wants a statewide shutdown. And I think this goes for schools as well. There is, again, a huge difference between a school in a densely populated suburb. Many of our school districts who have potentially newer HVAC systems, potentially newer buildings, versus, a school district that might be in a more rural area, but maybe their buildings are older and they don't have good HVAC systems. So I do think there has to be some consideration given to how safe it is in certain schools. And also, I would love to see more of a priority for making sure that schools can be open for the kids who need it most. Thinking about special education students who really struggle with virtual learning, or students who have a single parent who works, or maybe both parents who work, who can't stay home with their kids. And that is why I really trust that decision-making happening on the local level. So the way our structure works now is that our school boards and school administrators work with the county health department to determine the best way forward. But I know that creates a real struggle for parents who are trying to figure out how to navigate their own work life when their kids are home or not home or in a hybrid system. And to me, that points to a larger need for affordable childcare, for solutions for parents who are grappling with this, and just how hard it is for teachers to have to pivot on a dime and create these new programs and respond to a change in climate when the best thing we can possibly do is do what is safe to control the spread of this virus, to make sure that schools can stay open. And that's what I hope to see moving forward. Lisa also asks if the Oakland County Health Department traces 90% or more of COVID spread to sports. Why haven't we regulated the MHSAA? Lisa, I don't know if that is a factual statement. We can check for you. And if you want to follow up with our office via email, we can look into that data. My understanding right now is that a majority of spread is coming from indoor gatherings. There has been an outbreak in office settings, kind of enclosed spaces that are indoor, where there is limited air circulation, where people are not wearing masks or talking to each other. So that's dinner parties, that's these homecoming parties, that's office environments. And I don't know that sports are as dangerous, particularly if they're outdoor sports. But we can certainly look into that for you. And if you send us an email, we can follow up with that. All right, switching topics. Paula Mante over from YouTube says, can you speak to the MIGOP potentially not certifying the election results in our state, threatening the 16 electoral college votes? Yeah, we have been getting a lot of questions and calls about the election, and Senator Mike Shirkey, through a spokesperson today, said that there is currently no mechanism in Michigan law that allows the legislature to appoint electors at odds with the will of the voters. So I know that there were a lot of stories. There was a piece in The Atlantic. There was a podcast about what happens in Michigan specifically if the legislature appoints electors at odds with the popular vote. That's not allowed legally in Michigan. So for the legislature to change that, they would have to introduce a bill. They would have to pass it through the legislature. Theoretically, they could do that because of the majority in the legislature right now, but the governor would veto it. So technically, there isn't a mechanism for that at the moment. But I know that we have been getting some outreach about that. Lisa, I see a number of additional comments, and my recommendation, and again, for those watching, this is Lisa, who's asking about schools. And one that I do want to point out is she states that no district has the money to comply with the, quote, highly recommended roadmap suggestions. Bloomfield and Birmingham are two of the best funded districts, and we couldn't comply with HVAC and ventilation. You're 100% right, and you're not going to hear any argument from me on this. I think, number one, we need to fundamentally overhaul how we fund our schools. We are dead last nationwide in increases to school funding, and that is unacceptable to me. That was a problem long before we hit COVID. But we know that the cost associated with creating a safe environment within schools is very, very costly. So I was pleased this year in the budget process that there were no cuts to schools, but we also know that we need, and we have been pushing on our federal colleagues for another relief package. And part of that relief package has to go to schools because the costs of potentially additional teachers, if you are going to a hybrid model or a staggered schedule, of upgrading HVAC systems, of making sure that there is enough PPE and safety supplies, is incredibly costly. But if we agree that keeping schools open is a priority for us, we have to push on the federal government to break the gridlock that they have in Congress, pass another COVID relief package, and make sure some of that money goes to schools. So, Lisa, I completely agree with you. And I really, really appreciate your comments. I would recommend, if you wouldn't mind, following up with our office directly. The email is, if I can point to it, right on the screen here. And if there are additional concerns, we can address those with staff. And then I will leave it open if anybody has any additional questions. I'm going to do a last call for questions. Feel free to throw them out there in any of the comment section. And otherwise, just really appreciate everybody joining today. We will compile some resources to be able to post via the comments. And I just want to create a, oh, great. Here's a comment. So Brandon Colo is commenting from our Facebook page, and Brandon is a current Royal Oak City Commissioner. And he says, speaking of relief packages, everyone should utilize the current programs that we have in place. We have food banks, housing assistance, and other programs still active and available. And this is 100% true, especially here in Oakland County. There are a lot of relief packages and funding that is available. If you go to the Oakland County OakGov website and search for coronavirus, you can see all of the programs that are open and available. Reach out through your local city as well. And we'd be happy to share any of the resources that are out there, particularly around small business grants and loans and programs to keep everybody afloat. So many of these programs still have funding in them, which is good, from either the First CARES package or from the state, and are available. Carrie asks, if they refuse funding, what are alternatives? Carrie, this is a very real concern and fear that I have. One of the frustrations that I had earlier this year in the legislature is we had a resolution that was introduced by some of my colleagues on the other side of the aisle in the House that was encouraging the state of Michigan to reject any additional federal funding or relief related to the coronavirus. This, from my understanding, was something that the organization ALEC was pushing for, that states shouldn't take quote unquote bailout money from the federal government, which I think, number one, is completely irresponsible, because we all pay federal taxes. Those are our dollars that are going to the federal government. And the idea that we wouldn't do everything as a state to get that funding back to us, especially when we need it most, is blatantly irresponsible. But if let's say Congress deadlocks and they don't pass another relief bill, there isn't any additional federal funding, we are going to head into the next fiscal year and have to make some very, very difficult cuts in our state budget. We were able to pass on a bipartisan basis a budget this year that largely didn't make any drastic cuts. Michigan actually came out much better towards the summer than we were anticipating in March. We had more revenues coming into the state, and we were actually 7th or 8th in the country in terms of economic recovery. From reopening, from getting back, we were operating at around 87 or 90% of the economy that we had prior to the outbreak of COVID-19. So Michigan was in a much better place than I think we anticipated at the beginning. But that's this year. That's the budget that we passed this year. We were able to leverage some federal funding to fill some budget holes creatively and respond to COVID. But even Steven Mnuchin, the Treasury Secretary, has been advising for another relief package. We need the federal government to pass that. And if they don't, it's going to be a really, really rough year next year. And there are going to be some drastic cuts that's going to set us back as a state. And it's not something that I am hoping for or looking forward to, but that is the reality. All right, Tad's got another question. Thanks for adding in these questions. Given the absentee ballots are now in the Constitution via ballot proposal passed several years ago, is it possible that the legislature can make improvements to that process, or would that also have to be a ballot proposal? One item in particular, could the legislature pass a bill to require a witness signature on a ballot confirming the voter was the person who filled out the ballot? So we can make changes legislatively. One of the changes that Majority Leader Shirkey identified today that could be a potential improvement to our system is that currently in Michigan, you cannot count any ballots until Election Day. We passed a law that would have granted clerks an additional day in advance to be able to process absentee ballots. That is quite literally just taking the inside ballot and secrecy sleeve out of the outer envelope and just getting it ready to count, which, believe it or not, saves hours and hours of time in counting. But many other states like Florida actually allows for clerks to start counting absentee ballots up to 22 days in advance, but keeping the results secret until Election Day. And Majority Leader Shirkey was hesitant to want to consider allowing for counting ahead of time, despite the fact that many of our clerks throughout my district, both Republican and Democrat, were asking for additional time ahead of Election Day to count those ballots. Majority Leader Shirkey said today that he would be willing to take a look at more of a Florida-like system where absentee ballots could be counted ahead of time. So we're not waiting for a day or 2 days or 3 days after an election is complete to get results. But Tad, on your question, I think that there would be a challenge. So we have a very strict signature verification process in Michigan already. So when you get an absentee ballot application, you have to fill it out and you have to sign it. You send that signed ballot application into your clerk. Your clerk then verifies your application against the signature that they have on file. The signature that they have on file is the most recent signature that you filed in the state. So for many people, this is the signature that's on your driver's license. This might be the signature that came off of your voter ID card that you registered with when you registered to vote. So if that signature does not match, you do not get a ballot. That is something that I think a lot of people don't understand in the state of Michigan, and a lot of applications are rejected for that reason. So, I think requiring a witness on a signature would potentially disenfranchise a lot of voters who maybe live alone, who are maybe seniors, for a variety of reasons, who may not have somebody there to witness them signing it, and would also create an additional challenge to that. But we're happy to share any information about the absentee ballot process. And then again, when you send that absentee ballot in that you've received, that absentee ballot and the signature on it is once again checked against the signature on file and will not be counted unless the signature matches. We passed a law this year that would require, if your ballot is rejected due to a signature not matching, that the clerk has to alert you so that you would know, number one, if somebody did try to file a ballot, although that very, very, very rarely happens, or if your signature has changed, and then you would have the opportunity to come in person to your clerk's office and fill out another ballot there. All right, last call for questions or comments. Greg McGuire, we need grant monies for mental illnesses as well. Greg, I completely agree. We have had, and Amanda chimes in as well, that this pandemic is very hard on our mental health, and we need to make this priority. And you're right. That is why when I approach these meetings and these conversations, I am sympathetic to how hard this is. This is hard for me. This is not what I wanted to go through. And yes, Greg, sorry for the dog in the background. This is the challenge of all of us working remotely. Detroit, the dog says hello to everybody. And I think we got a package outside. But this is hard. This is hard for everybody. And mental health care in the state of Michigan is severely lacking and has been severely lacking for a long time. One of the examples that I use very often is that in schools, for example, the recommended number of counselors per student is 250 students for every counselor. In Michigan, our average is one counselor for every 758 students. And when I talk to students, many students that I talk to don't know that they have a school counselor. They don't know how to get in touch with their school counselor or social worker. And oftentimes that counselor is so overworked just dealing with, helping students apply for college or scheduling issues that they're not really available for students to talk to if they're going through mental health challenges. I recently just talked to the new CEO of the Oakland County, I believe it's the Mental Health Organization. Don't quote me on the name of it, but we do have resources here in Oakland County, and that's something that I'm going to be working on, over the rest of my first term and hopefully second term, if I can come back, if voters trust me with that again, is how we better connect people with the resources that we have. I think that Oakland County in particular, we are very, very lucky, and I am very grateful for this every day. We are a county that does have a lot of resources and a lot of resources that are available for people. So number one, I want to make sure people are aware of what those resources are and get connected to the help that they need. But beyond that, we do have to fundamentally overhaul our mental health system here in the state, make sure that we are treating mental health care as the equivalent as physical health care, and make it easier for people to access services, make it easier for people to even know that they should reach out for services. It's something that is a passion of mine as somebody who has ADHD, is reversing the stigma around mental health, that somehow there's something wrong with you if you reach out for mental health care, which is fundamentally untrue. Especially right now, everybody is going through something, and if you need support, that should be there for you. But I really appreciate the comments, bringing that to our attention, and I promise it's something that we will keep working on and moving forward with. All right. I've talked for a long time, so if there aren't any last questions or comments, once again, getting used to this graphics thing. If you have any additional questions, email us. Our staff is always available to take any questions or comments or concerns. I also encourage you to sign up for our email newsletter, which is available at senatormcmorrow.com, and my staff will drop a link into the comments as well. We send out this newsletter just about every 2 weeks, and it includes a summary of what's happening in the state, every bill that has moved through the legislature, what we voted on, and then any kind of additional information you will need to know. It is stateside, so you're not going to get, campaign email from me. I'm not going to ask you to donate to my campaign from that email. So it's official. You're not going to get spammed. It's just to keep up with what's happening in the legislature, and I would highly encourage you to sign up for that. And then let's see if I can do, look at that. All right, I switched graphics. Look how cool this is. If you want to follow along on Twitter, that is my handle over on Twitter. And yeah, we're just trying new ways to be able to reach as many people as possible. And I hope that you and your families stay very safe as we head into the holidays and into this winter. And I know how hard this is, and we're going to get through this together. And yeah, thank you so much for joining me, and happy Friday, and have a safe weekend.